Hi, I'm Michael Seilback with the American Lung Association in New York.
Spell.
Sorry, S is in Sam, E-I-L-B-A-C-K.
All right, so whoever wants to jump in here, just jump in. I'm trying to figure out, I mean, is this sort of like prolonging the obvious here? What are all the studies pointing to? Is it pointing to that this is bad or this is good? I mean, there's got to be one of those answers, right? It seems like we're all confused as to what is it? Is it bad for us or is it good for us?
I think the main thing is, like what someone said before, let's put the brakes on it. Gas isn't going anywhere. Let's wait until we have some comprehensive health assessments before we move forward with issuing any permits. I think that's probably the most common sense move that the governor can make.
Okay, but
I don't think we have enough studies. Right?
We don't know.
We don't have enough studies that are peer-reviewed and that would turn the politicians' minds around at this point. And that's why we're calling for a health impact assessment, because we do have preliminary evidence. We've spoken with people in the states where they're impacted: Ohio, Pennsylvania, Illinois, Wisconsin, Oklahoma. We've spoken to the people there, and we know that they're getting sick near gas drilling operations. But that pathway of exposure needs to be established, and that's going to prove what the actual health impact is. Those studies need to be done, and that's what the health impact assessment would help us find out.
Okay, so hold on for that. Instead of asking questions later, is that the idea?
Exactly.
Right. I mean, the bottom line is we know that certain parts of this process absolutely have health effects. The diesel trucks that are going to be commuting in and out of these communities every day are directly linked to air pollution problems and problems with lung health. We know that other parts of this process have been linked to health problems, and we need to know more. We need to have some peer-reviewed data so that the decision makers could make decisions based on health and based on science.
Okay. So at this point, to tell my audience tonight that we don't really know the effects of this yet, is that the cut and dry answer, or we do know but we don't know enough? What is it?
We do know that it's harmful to many people, but we don't know enough. We need more peer-reviewed information. And the reason that we are advocating for the health impact assessment is because it would advise policy before the decision is made. And that's what is so important, because it will not harm people in New York State. It will proactively look at all of the impacts, direct and indirect, all of the environmental contaminants, and will give people a risk, will give people an opportunity to decide, and to our politicians to decide whether or not they want to move forward with this.
All right, so you want them to wait for those other 3 studies from other states too, from other entities? Why?
Well,
what if he finishes his, and it's good or it's bad, either way? You still want him to wait?
When he finishes his, you mean Dr. Shaw?
Dr. Shaw.
He
when
hasn't
finishes.
done a study.
Well, I mean,
there is no study going on in New York State. He's reviewing some information that was provided from the Department of Environmental Conservation.
Isn't it kind of like a study, right? He's reviewing what's...
It's not health information.
It's not health information.
Right.
So you guys want him to wait for those other studies to finish?
He should wait for those other studies, but at the same time, he could undertake a health impact assessment in New York State.
He has not done that.
Correct.
You're pushing him to do that.
That's what we want.
That's what you want.
We want to look at the short term, but more importantly, the long term effects that this will have.
So this will take forever, though, right? Because I mean, those people want to start drilling and give people jobs. That's what they say.
Oh, what I said before is it
Okay,
going?
that's what they. I'm playing devil.
Yeah, that's fine.
That's what they say.
Right, but the jobs are jobs that we've researched, and we know that the mortality rate in the oil and gas industry is 8 times that of the average worker in the United States. Those are often entry-level workers, and those are the kind of people who would be entering into that job market in New York State. Is that the kind of job that we want our young people to go into? Also, the workers are often working and living in areas that are socially socially problematic. You know, they change the communities where they're coming into. The communities and the society is not prepared for them, for the number for the problems that they bring in, and frankly, some of those are pretty bad, like drugs and sexually transmitted diseases. That's been proven. So communities need to be prepared if they're going to be having workers from this industry. But again, are these the kinds of jobs that we want our young people to go into? So jobs, yes, perhaps, but perhaps not such great jobs.
Final question.
I mean, I would just jump in. You know, we're here today because a wide group of health professionals, of medical professionals and physicians are here saying we need the science, we need the data. We need to make sure that we're not bringing new industry into areas of our state that have clean air as of now. We want to make sure that no decisions are made until we know that we're not going to leave New Yorkers more unhealthy in the future than they are today.
Okay. That's cut and dry.
Yeah.
Thank you.
Thank you.
That's a good
Good meeting you.
Thank you.